I want to introduce you to our guest today. She is amazing, phenomenal. Her name is Dr. Funke Afolabi-Brown. I'm going to tell you a little bit about her before we get started. So Dr. Brown is an assistant professor of pediatrics, as well as a board-certified pediatrician, pulmonologist, and sleep medicine physician. She helps children sleep better and breathe better. And by extension, she helps improve the sleep of their parents. In addition to teaching and seeing patients, Dr. Brown is a speaker, a writer, and the founder of Restful Sleep MD. She is really passionate about educating and empowering busy women and their children on the importance of prioritizing sleep to achieve their optimal health and live to their fullest potential. How amazing does that sound, guys? That sounds really cool. So without further ado, welcome, Dr. Brown.
Thank you so much. Thank you so much for having me, Dr. Schramm. I am a fan of the work you do. And like I was saying earlier, I think we just kind of connect on so many levels in the terms of, your work and sleep and how that all just comes together. So I'm really excited about our talk today.
Yes, me too. Me too. So, I talked about all of your accolades. You're an incredibly accomplished physician. I would just love to know your story.
Yeah, absolutely. Absolutely. So I would say sleep has been something that I knew was important, right? From medical school, I think that was when I started to realize I had some struggles with sleep. I couldn't really figure out who I was at that time, right? A lot of peer pressure. So initially, when we would go studying and all my friends would go to like the study halls. And so maybe they would leave to go study at about, I don't know, like 10 p.m. And so we would go and try to pull the all-nighter. And so I would go because I'm like, okay, I think that's what I'm supposed to do. And so I would get there on and off, just dozing, just really making a joke of myself, and then, come back with them. And then, 2 hours later, wake up and be ready to take on the next day. And if we had a test, it wasn't really working for me. It was not working. I wouldn't recall, I wouldn't remember. And all this is in retrospect. But then at some point, I'm like, you know what, Funke, you do need sleep because it seems like, it's not making you a better person trying to just follow the crowd, And so what I did was I shifted. And so when everybody else was going to the study halls, I would just stay and sleep. So even though I wasn't getting enough number of hours of sleep, I would sleep and then wake up a little bit early, maybe 4 or 5 a.m. to study, even if it's for 2 or 3 hours before I then go to class. And it made a world of difference with my mood, with my learning and memory and things like that. And then, of course, fast forward, I became a doctor. I did pediatric pulmonology and was taking care of children with a lot of breathing and disorders. But then again, sleep came up because a lot of these children, maybe if they have asthma, are coughing all night. And so it's impacting their sleep. And it's this vicious cycle. And then I also take care of very complicated patients with like all sorts of like weird sleep disordered breathing on ventilators at night. And so I really wanted to get my expertise down on sleep. And so I went ahead and did a training in sleep fellowship training. And that just really opened my eyes more to the science of it, the importance of sleep, not just to help with breathing, because yes, when you sleep better, you breathe better, but just the other parts of it, the importance of sleep to our entire health, right from memory, mood, cognition, to learning, to, our physical health, cardiovascular outcomes, and the whole gamut. And so I think it's like you move forward, all this, what do you do with it? Realizing that I wasn't really trained to know this from nobody. Nobody taught me, nobody, it's not part of our curriculum, even in medical school. Maybe they'll give you a talk on fatigue and that's it, And so then, empowered with all this information, I think that's just really been my mission now, like helping people understand, one, sleep is actually very critical to our wellness, to our overall health. And two, it's something that's achievable. You don't need too many resources. You need a good bed and you need the right environment. And I think you need the right mindset, of course, if you have insomnia and you could do it. And so really that's been my mission. and I'm living it too. I'm prioritizing sleep. So I think about it, like I know this and I see it in my daily walk. And so I'm just really passionate about engaging people to do the same.
I can see that. That's a fascinating story. So like it was actually like a lived felt experience for you. I had very similar experiences in college for sure, where I would pull these all-nighters and I would not do very well on my tests.
Yeah, I know.
And then, there was like, I graduated from medical school in 2000 and then residency afterwards. And I think that was before the 80-hour work rule. And we had a lot of Q3 shifts and things like that. And so there was kind of like a sub, like a little bit subliminal message of like, your sleep just isn't important. And so you're gonna work this 36-hour shift, like everybody else is doing it. Everybody else did it and they're fine.
Yeah.
So suck it up kind of thing. And so I think I took that and ran with it for probably a little bit too long and didn't give my body too much time to sleep. I was like, there's like this really counterintuitive thing where, and I read somewhere too, like we're like humans are the only mammals that like actually keep ourselves from sleeping when we're sleepy. I was one of those mammals. A biped. And
Exactly.
I would like work until, this was, even after I had kids and everything, until midnight or 1 o'clock in the morning. And of course, just, I was always tired. I was always irritable. And then I was like, oh, I have insomnia. Like, I'd like work, and then get in bed by 1 and then be surprised why I can't fall asleep, so I wasn't giving myself really an opportunity. I was not giving my body an opportunity. So I bet those are some of the things that you talk about when you're talking to the parents and the kids.
Absolutely. That is so true. As in, if you think about evolution, that's something that has not changed. Our sleep requirements has not changed. We all still need, depending on our age, adults, we say 7 to 9 hours of sleep, but we as mammals, or we as humans, just want to shortchange that as much as possible. But it has its impact, and I think we can change that. I
Yeah,
totally
for
agree.
sure. Tell us maybe like 3 or 4 consequences. We don't ever want to live with fear, but I think if we don't even understand, we might not really do the thing. So maybe it like touches up on a few things that, chronically losing sleep can do for us.
Absolutely. So I think one of the several studies, right, has been done looking at adults and even children. I would start with even just the physical health, physical manifestations of sleep. So studies have shown that there's increased risk of cardiovascular outcomes. So people are at increased risk of heart attacks, an increased risk of stroke when they don't have sufficient amount of sleep, not just in terms of the quantity, but also the quality. There's also been lots of studies now looking at our immune system. So there are different stages of sleep. So slow wave sleep, and then, there's light sleep, there's deep sleep, and then there's the REM sleep. So those stages of sleep actually have their function. And slow wave sleep is really when you get a lot of tissue repair and regeneration and restoration. And so if you're not, and your immune system actually gets like pretty much regulated in slow wave sleep. So you will notice that, or studies have also shown that people that don't get adequate amount of sleep actually at risk for developing infections. And more recently, even some cancers actually, because certain cells, the natural killer cells, which are like your fighter cells, are dysregulated in the presence of inadequate sleep, and some cancers are actually being associated with insufficient sleep. So these are like really, really key things. And then there's the memory piece of it, and the learning and clearing of toxic materials. So when you do sleep, your brain actually performs a function of cleansing. And there's this system in our brain, like the lymphatic systems in our body. It's called the glymphatic system. And so toxic products are built during the course of the day, during wakefulness. And so it's when you sleep that that system actually kicks in to wash those waste products away. And now, because a lot of studies are now showing that there is that link between insufficient sleep and development of, conditions like Alzheimer's and things like that, because some of those toxic products are related or causative for those diseases. So it's really, really important to, and then of course the mood piece, learning, decision making. Just think life.
Yeah, for
You
sure.
know,
Right. I mean, that's a
yeah,
really comprehensive list of things that teach that, insomnia or lack of sleep and even lack of the quality of sleep, like you were talking about. So heart attack,
yeah,
stroke, immunity, increased risk of cancer, increased risk of Alzheimer's disease, increased risk of cognitive issues. All of those are really serious and they're absolutely worth avoiding. And we
yeah.
actually understand how to avoid those. So one of the things that I talk to my patients about a lot is they'll come in and they want a prescription for Ambien, Zolpidem, or they want a
Mm.
prescription for another sedative hypnotic. And I go through kind of a long explanation for it because we now know that it really keeps us, it inhibits the types of sleep cycles that you were talking about. I wonder if you could speak to that a little bit.
Yeah, absolutely. So we all go through this sleep cycles, right? Each cycle is about 90 minutes. So between going to the non-REM sleep and the REM sleep are the two broad groups. So the non-REM sleep is like stage 1, 2, 3. We keep it very simple. In sleep, it's like stage 1, stage 2, stage 3 is your deepest sleep. And then the REM sleep is sort of your what you call your dream sleep. And during that time is where you're dreaming. During that time is where mood and things like that really gets regulated, and memory consolidation and things like that is occurring. And so you cycle through those, and then you go through those cycles. About 5 cycles is ideal if you're sleeping the right number of hours at night. But a lot of these medications actually distort that. And most of them, some of them may be, they may help with depression and things like that, but at times they decrease the amount of REM sleep you're getting. So it's acts as a sedative, but it's completely different from the natural sleep that your body needs. And one of the other issues with a lot of those medications is that eventually people just habituate to it, and then they stop responding, and so you keep going up and up and up and up, rather than addressing the underlying issue. And then again, because those medications are sedatives, if you don't even give yourself the adequate number of hours of opportunity of sleep, you then have a lot of the daytime side effects as well. So overall, really not your go-to, even for insomnia. And that's why the American Academy of Sleep Medicine recommends that the gold standard for treatment of insomnia is what you call cognitive behavioral therapy. And a lot of this is just more of developing new habits to sleep, which is sustainable, because we will all go through bouts of insomnia. If something happens in your family or something, there's a change, it will affect your sleep briefly. But when you have those strategies in place as someone who does have insomnia, then you can just implement them, and so it's definitely more sustainable, it's effective, and it doesn't have side effects.
Right.
Yeah, right.
That's the, thing every time I try to talk about whether it's like meditation, mindfulness, exercise, plant-based
Exactly.
eating, it doesn't have any side effects. And so, yeah, that's
Exactly.
really, really helpful. That explanation of, these different cycles of like, stage 1, 2, 3, and 3 is kind of your deep, and then you get your REM. And guess what? Like we think that there's less REM sleep. And those are things that we're just now understanding because I remember when they came out, there was sort of like this hard sell on, oh, well, don't worry, it really mimics sleep in every way that, in all the studies that we've done. And so I think a lot of patients got on those medications back then, and they still find it difficult to come off of it. So that's something that I tend to work on with my patients a good bit as well. And that's really helpful how you explained it, because I think coming from a sleep expert is of high value for sure, for sure. So in terms of like some tips, if you can share maybe some of your top tips that you've seen work for you, your family, and for the folks that you work with, as far as like helping us get better sleep, not just as, moms and parents, but also for our kids as well. I have teenagers.
Oh yeah. Oh, I love teenagers. They're my favorite. I have one that's coming up, so we're already seeing that. One thing I would say for teenagers though that I usually try to point out too is their body clock, their circadian rhythm shifts. So their bodies prefer a later bedtime, but then there's all these other things, all these external factors as well. Devices, social media that further makes it harder for them to sleep. So the way I just make it simple, because if you Google sleep hygiene, you'll get a list of 20. You're like, oh my God, which one's important? Which one should I focus on? And I think that tends to sometimes overwhelm parents too. And and their children, their parents, and things like that. So I came up with an acronym, CREATE. So create healthy sleep habits. I don't like to call them sleep hygiene because it kind of connotes like cleanliness, So I just say healthy sleep habits, And so create, CREATE. So C is the consistency, setting a consistent sleep time and a consistent wake time. I think that is so important because we are literally training our circadian rhythm to stick to that time. And so that's really of everything, of all those tips, that's really one thing that I feel is so important. So really setting our clocks at the right time. So that's C, consistent sleep time and wake time. And then R stands for routine. And so we are creatures of habit, right? Our bodies, our brains, our bodies get used to the same thing over and over again. And if you think about babies, infants, we all have this beautiful routine. They would have a bath, we'll read a book, or sing a song, we'll kiss goodnight. And then they're older and it's like, okay, you're on your own. And so they're like on their devices and then plopping into bed. So we really should, even for our teenagers and our parents as role models, to really have a routine, nothing too complex, really 2 to 3 activities is what I say that leads you in the direction of the bedroom. So a warm shower is really nice because it makes your body temperature come down as well. And then, do some reading or meditation, some practices that really just takes you in that headed towards sleep. And then E, I talk about is the environment. So if you're in a room that's brightly lit, that's loud, there's the TV going on and, the bed's uncomfortable, that's not ideal. So you want somewhere that's cool, that's dark, and it's noise free as much as possible. And so really getting you in that place for sleep. And then for A stands for assign the bed for sleep and sleep only in bed. And so this is something that my teenagers do get into where there's like all over the place, or the bedroom is, the movie theater, the bedroom is their workstation, the bedroom is the dining room, all that stuff is going on in bed. And so when it's time to sleep, the brain's like, okay, are we gonna read now? Are we gonna watch a movie? What are we gonna do? So really trying to assign bed for sleep and sleep in bed. T is tackle technology. So really getting rid of those devices. I mean, this is something we say again and again and again, but it's really the truth. For me, I talk about 2 things that the technology, that's your iPhone or your video games or the TV does, is that it has this blue wavelength light, which suppresses melatonin, which is a darkness hormone that helps you really get ready for sleep. And so your brain is like, okay, I think it's still daytime and melatonin is not well produced. And then the other piece is the notifications piece. So I have teenagers that are like, oh, well, I have my, night mode, so I should be good. Yeah, you have your night mode, but you're responding to text, you're aggravated. It's really going to be hard for you to fall asleep. Where are we? Okay, then E is eliminate caffeine, because caffeine is a stimulant. So if you're taking caffeine after 2 p.m., in some children and even in adults, it may still be in your system for as long as 8 hours before bed. So really trying to eliminate caffeine as much as possible, as well as heavy meals before bed. Heavy meals, of course, you need 2 to 3 hours for food to digest. So if you're eating a large steak and big dinner and then plopping into bed, first of all, the reflux and the discomfort is not going to help. So those, I feel like when I provide that, it's sort of, okay, CREATE, create, it kind of helps people remember better. And so I hope that's helpful for.
That's hugely helpful. It's gold, actually. And it keeps the overwhelm at bay, right?
Yeah.
And I love that you've dropped the hygiene part of that, because I've always sort of been like, isn't there a better way we can describe it? Because it almost sounds like, well, you're dirty if you're not doing it.
Exactly.
Like I love how you changed that. And I love how you took something so complicated and you came up with this beautiful acronym. And it ultimately at the heart of all that, it's all pretty intuitive. And so it's when we like run away from our intuition and stop listening to our inner selves and we like, succumb to all the stress and all the conditioning that life has, in store for us. I feel like that's when things start to go south for us. But I love that. That is absolute gold. I hope you guys got that, because that is amazing. I've got it written down here. And yeah, if I had even understood part of that as like a new mom, I think I would have just wouldn't have had the raccoon eyes. First of all, like I look at some photos and I'm like, what the? Why did I look like that?
I know. And you're like, what concealer am I going to get?
No, nothing works. Just sleep. Just sleep.
I know.
Yeah. Oh, this has been fantastic, Dr. Brown. How can people find you?
Yeah, sure. So I am Restful Sleep MD. You'll find me on Instagram is where I'm most active, as well as Facebook. And my website is coming up soon. So definitely be on the lookout.
Yeah, absolutely. And we'll put all that in the notes here too. Thank you so much for taking this time to educate us and entertain us and inspire us. It's really, really helpful. Thank you.
Thank you so much, Dr. Sharon. It's been great being here.
Yes.